Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello and welcome to this episode of the Healthcare Connections podcast. I am your host, Jeremy Winn, the Director of Sales here at Healthcare Compliance Pros. Excited to talk with Matt Seefeld today. He is the CEO at Medevolve, and in full disclosure, they are a client of ours, a longtime client. We love working with them, managing their compliance. But Matt, welcome to the episode today.
Yeah, thanks, Jeremy. I'm glad to be on board, and I appreciate your exceptional service because it's one thing I don't have to stress out about on the compliance side of healthcare. So
that's always our goal. Let you keep focusing on growing your business. We'll take care of this side. So, Matt, let's start with an introduction of yourself, maybe a little bit of your background leading up to when you got involved with Medevolve and your journey with Medevolve so far.
Yeah, absolutely. I came right out of undergrad and went right into healthcare revenue cycle consulting. So I started with they were a boutique firm, a bunch of ex-Andersen consulting guys in the late 80s who said, hey, if I install some workflow automation technology and some dashboarding KPIs, key performance indicators, could I go at risk for my consulting engagements? And it worked. So Dale Stockamp really infused in me this concept of measure to improve. So I was with them for about 4 years and then went on to the PricewaterhouseCoopers, where I actually built my first workflow system for them. It was on a Microsoft Access. For those listeners who can go back, I'm dating myself. And then I went on to Deloitte and Touche, and I actually wanted to build the cloud version of this. And they said they loved the idea. They didn't want to make the investment just yet. So at 29, I packed my Forerunner and drove from Atlanta, where I was living, back to San Diego to start Interpoint Partners, sleeping on my best friend's couch, not knowing that the Great Recession was about to hit 2008, 9, and 10. So I learned a lot. We'll have to do another podcast on what it takes to be an entrepreneur, not go out of business with no capital. It was an exciting journey. My whole career has been on finding ways to upgrade the practice management systems with actual technology that measures touches, right? I think the big misnomer in this industry is the amount of touches by humans it takes to get a claim paid, to claim to zero balance. And we'll get into this, I know, in our podcast, but we're very attuned with defining an actionable touch versus a wasted touch. But prior to any of that, it's why is the human even having to get involved? Okay. So that's really was the big piece for me is that I've given up in, what is it, 2026 now, I've given up on the EMRs to figure this out, right? Even the big blue chips. And it's not their fault because they have to focus on competing with the other 1,000 EMRs. Right. They have to focus on physician preference, and they have to focus on patient engagement, right? Making sure the consumer has a good experience as they go through their services. The challenge is if you're out of business, those things don't matter. And that's really the reality of where we're at. So I came on board to Medevolve in 2017 as really a favor to the CEO at the time to look at the business. I'd been around for a long time, founded by two orthopedic surgeons, had a good practice management system, no EMR, and they had an RCM services business. And so I saw another opportunity in my career to build an upgrade to the PM system, to measure work, drive work to the workers, front, middle, back of the rev cycle, and then start to really look at human performance, as it relates to the financial outcomes that our clients were getting. And that really changed the whole scope of the business. We were acquired back in the fall by the Pritzker organization. Emergent Software is the company that acquired us. So
congratulations, by the way.
Thank you. Yeah, it's a process going through selling your company. I've done it twice. I had sold Interpoint in 2011 to a public company, and that was a process. And so here we are again. But the nice thing about the Pritzker organization and Emergent Software and Henry Zhang, the CEO, is that we're very aligned that this industry is in a desperate state. We know that automation has to be a high focus, but we know that the quality of that automation has to be important. And we're here to make sure that as many people in this country can get served good health services. And the challenge that I see in this industry now is that people with means can still get served, but the people that without means or people that are unemployed, they're having to go to the emergency rooms for primary care, right? And then they don't have the money to pay those bills, and so it becomes a bad debt write-off, and it's putting stress on these revenue cycles. So our mission together is to acquire companies, really, to continue to organically grow our company, to build big partnerships with organizations that are really focused on one, automating as much as we can by further identifying waste in the revenue cycle and being very deliberate in how we do that, whether it's through agentic AI or just generative AI, machine learning. Number two is providing leading benchmarks to an industry that's been forced to use outdated lagging indicators for decades, right? Very subjective, doesn't really tell you why the problem's occurring, right? And can all be manipulated. And then the third component is really how do our clients hold third party vendors accountable? So much of this industry outsources to
Right.
other, some onshore, offshore, nearshore. And so they're really flying blind on performance. So we want to put the power in our clients to say, hey, I'm getting a good deal or I'm not, right? And the same would go with the payer accountability, right? How do we hold payers more accountable now with real data, right? How hard are we having to work for payments for their patients that are consuming our healthcare resources, right? Our clients. So that's really the vision of the business is that we know we sit on a massive data set that nobody has access to. We know that will drive much more sophisticated algorithms, whether it's AI coding, prior auth automation, better clearinghouse information, right? We know we have some novelty there, but you know, this industry is really in tough shape. I do a lot of public speaking. I can tell you, if I looked at the last 3 years in particular, the conversations I'm having are not happy, yay, growth story conversations. It's how do I survive the next 3 years?
Yeah, thank you. That's a great intro, and you highlighted some of the areas that I wanted to touch on. Let's start with you call it wasted touches, and you shared with me that that's an area where there's a lot of margin being lost there. It's killing margins, these wasted touches. Dive deeper in that. Where are you seeing those wasted touches? How are you looking to fix those again through the tools and stuff that you're building?
Yeah. Yeah, I mean, so the first thing to just note is the practice management systems were never designed to measure a touch, whether it's a wasted touch or an actual touch. And what I mean by wasted touch is it's something that never should have had to be looked at by a human. So it could be an issue, the authorization was required, nobody got it. So now you're trying to fight for the denial. But it also could be you have your AR team following up on claims far too soon, right? Blue Cross pays in 30 days, and yet they want to look at it day 14, day 21. So every touch is eroding margin, right? If your average cost per touch could be anywhere from $3 to $8, depending on where your people are. Okay. So our clients have to start thinking in that fashion. If I have a million touches in a year and I reduce my wasted touches by say 30-40%, and it's $4 a touch, that starts to become very meaningful to improving margin and longevity. So the biggest challenge is the fact that the classification is not possible within these legacy PMEMR systems, and even the big ones, the blue chips. I won't name names, right? But there were, but they never, because it was never thought of from a benchmark standpoint, right? We're coming at it from actually the outcome and saying, hey, wow, this is a plague. What can we now do to better identify waste? But then also put a benchmark associated to it. So wasted touches on average are somewhere between 60 and 85%. So to kind of put that in context, let's say you have 10 people following up on commercially insured AR, right? If they're all working 100 a day, or so let's say 50 a day, be realistic, about 10 to 20% of that work would drive a change in AR.
Mm-hmm.
Think about that. So there's ball is not moving down the field at all on about 80% of their day. Now, of the change in ER, then the question is, did you get paid on the first touch? So, so we have, built these indicators now that tell our clients in real time where their baseline is, right? I got a client we just went live with. Their first month, they had 78% wasted touches.
Wow.
I mean, so hey, nowhere but up from here, right? In that case, it's down, right? Because we want those wasted touches to go down. But that client prior to go live couldn't even think in the context of a wasted touch.
Yeah.
So number one is identifying why these are occurring. Is it an issue with a person, right? They're not trained or they're not motivated. Is it a process issue, right? Maybe their pre-registration process is totally decentralized. There's no accountability. And maybe it's a technology issue, right? There's a huge movement the last 3 or 4 years around AI. But what we're finding is more than half of the touches by these AI bots are actually creating mistakes. And those mistakes then result in the human having to also then look at it. So I always warn prospects and clients. I said, you don't start with the AI, start with measuring where the issues are, and then determining which part of rev cycle AI would help you. And in some cases, it's not mature enough to help you.
Right.
So you're wasting time and energy with IT resources to find out that you overpaid for something that's not valuable. So that's really the first piece is understanding from the time of intake, whether a patient is scheduled for a procedure, they walk into an emergency room, right? Till the time that claim is fully adjudicated, it's the plague. I tell everyone I talk to is that everyone is overstaffed by at least 30 to 50%. And most of the time people are like, this guy's crazy because they don't feel overstaffed.
No, because they all feel like they're drowning.
Because they don't have a way to put the reality around the situation, which is if you could just reduce the wasted touches, whether it's coming from denials or following up too soon or too frequently, or it's the human behavior, right?
Yeah.
You would see a huge improvement to labor capacity. And so if you have clients who are growing, which we like growth, you don't have to hire anybody and you can still grow 10, 20, 30%. So that's all mailbox money.
Yep.
At the same time, we have now objective ways to measure the people. So we know, who is actually high performers and who are low performers. And so now our clients have an opportunity to make decisions about those people. Do you leave them on the team? Do you recognize and reward them for being high performers? Right? Do you have better ways to interview people as you onboard new FTEs, saying, "Hey, you're welcome aboard. By the way, you're going to be measured these ways. They're objective. You're going to be baseline the first month, and then you're going to have performance reviews are going to be tied to those." When I ask clients during the sales process, how do you measure people? I can never get an answer. Literally, it's like, well, I mean, Jeremy's good at what he does. I'm like, how do you know Jeremy's good at what he does?
Like
They
him.
don't. They like him, right? Or it's super convoluted. It's like, well, we kind of look at a few of Jeremy's accounts every week just to make sure the follow up seems good. So who can do that? Like, who can do that? Like, you can't do that. That's a needle, right? We got to have our clients want to step back 30,000 feet and say, wow, I'm in good standing or I'm not. So I think that's really the biggest piece. And one component, which is a big benchmark for us, is zero touch rate, is how much of your money actually comes in and no human had to get involved.
Yeah.
Right. We want our clients greater than 85%, but the baselines of the industry is like 40 to 55%.
Wow,
we're looking at tens of millions of touches over the last couple of years across all levels of care and specialties. And that's the other plague, right? Is you have such bad upstream processes. Some's related to payer gains and all that, but such bad upstream processes and lack of accountability that you don't get a lot of your money without a human getting involved. And that's a component of what then becomes a wasted touch. And then the biggest plague is when you touch it again, and again, you're still no outcome. So average touches per to claim resolution is a big benchmark for us. And the industry sits about 1.9 to 2.5, and we want our clients less than 1.1, 1.2, right? If you're having to touch things excessively, then you have to ask your question, why?
Yeah, if you need to touch it once.
Touch it once, right? I mean, and part of touching it once and getting a result is it's we look at a first pass payment rate, which is the human engaged with it, payment came in, yay, versus the human engaged with it and it didn't come in. So our algorithms are very specific. We actually only give credit to the people who influenced it, and that's another gap in the practice management world is that they can't do that. I mean, their data tables are not even set up correctly to do that, nor would it be a strategy for them. So this is where companies like us have had to fill gaps.
Thank you. That's fascinating, and we could probably go 30 minutes just on that topic. But I want to touch on one thing you shared with me as we were preparing for this. You talked about, and I think we're seeing it, and there's been a big rush in the whole revenue cycle game of trying to find margin, save money by offshoring or nearshoring employees, and what you found is actually that maybe in the end doesn't save money, but actually the best thing might be to stay on shore maintain profit, through, optimizing sounds like processes. But maybe touch on what you're seeing in the space. Is it changing? Is offshoring still what everybody's trying to do, or are you starting to see that pull back?
Yeah, I think I mean the 2.5 decades I've been in the industry, right? Especially probably the last 20 years, it was, and a lot of it was led by the clinical folks, right? Is that physicians see their overhead going up and their margins are going down, their paychecks are getting leaner. So what's the natural thing? Cheaper. And so there was. I mean, go look at. I mean, I feel like every country in the world supports America, U.S. healthcare revenue cycle management services, right? And then what we're learning through all of the data we have is that they're actually not nearly as effective as trained onshore people. So you could be paying $25 an hour for an onshore person. You could be paying $6 to $12 for offshore. But if your effectiveness, right, is much higher for onshore, that's going to offset the savings. So that's number one. The other thing that we're just starting to see is the turnover in these countries is very high. So imagine training. We have a large client who just discovered that they were supposed to have, I think, 15 AR representatives assigned to them from this offshore BPO. And when we looked at touches over the last 90 days, there was over 150 that had at least one touch. So how do you have accountability?
Wow.
Okay. And then when they ask their BPO, the CEO comes back and says, well, we've had some turnover. So you're training. So you've got a client who's training an offshore company on protocols to follow up on these types of denials for Blue Cross. Then that resource leaves a month later and a new person gets assigned. Now the client has to go train that. So it's actually a double whammy. It's a wasting time of the onshore management to have to train on protocols and make sure that everyone understands how to follow these appeals, right? Number one. And number two is their effectiveness is not nearly as good. And one of the reasons is it's because of the complexity in denials and what they're able to work and appeal and how to do these things. So we see it in the data. Like I said, these aren't broad statements. These are factual statements that I speak to. So offshore has a place, right? When you look at like transactional work, right? Just posting the payment, charge entry, data entry, things like that, right? I think there's definitely a place. You just have to be careful, right? You got to be careful because it's at the end of the day, it's your margin you're worried about. But when it comes to the more complex functions, when you're looking at like medical coding, AR follow-up, billing, we're seeing it. We've had a lot of clients terminate contracts. We've had a lot of clients change vendors because of the touch data that starts to really show the lack there of consistent performance. So it's again, cheaper is not better when it comes to this. And I think that I'm starting to see the industry realize that a little bit. But when your margins are shrinking, cheaper seems better.
Cheaper sounds really good. Yeah.
Yeah. Well, and the other thing to remember, right? Rev cycle is simple, right? It's the cost to collect the dollar, and then it's how much of the dollar did I actually get, and so that we call that net revenue or net collection rate. We see anywhere from a 2 to 6% improvement on NCR. So if we come bring a new client on, all of those avoidable write-offs, denials that were never overturned, right? They weren't worked timely. The auth was never received. They didn't get it right. That becomes extremely painful when you look at the income statement. So you're overstaffed on the cost side, or you're overstaffed and paying cheap but not effective offshore. And then on the right side, you're not collecting even close to what your contract says you should. So you have this like double whammy where we're reducing the labor cost, improving capacity, holding people accountable, and we're improving net revenue. So the margins for our clients start to become very strong. It doesn't buy decades of longevity. I always make the joke, we're buying time for hopefully at some point the government to realize you're going to have to regulate something here.
Yes.
This is not a sustainable model. No, and anyone that says there would be is lying. So we have to be really careful of putting these things in their spot. And the payers, remember, right? The payers are playing a lot of games, right? They're down coding. You and I were talking about that before the show started. They're using a lot of AI. They have a lot more money to invest in AI, right? Their bots are hanging up on our bots. They're playing the game of there's not enough people for providers to follow up timely, and they're not going to have to pay for all the services. So this is another thing that nobody's really looking at around accountability. These big insurance companies do not want to, especially the public ones, they don't want to have to tell the street that they missed their numbers. Nope. Because they're actually paying for services that their people should be getting.
They're obligated, obligated to pay and contractually obligated. So yeah, this is fascinating, Matt. So for those that are listening, right, that are feeling this pain right now and probably know, yeah, there's a lot of wasted touches, but we don't know where to find them, how to track it. What's the best way to get a hold of Medevolve? And it's probably not you directly. I'm sure you got a team. Best way to contact for more info.
Yeah, absolutely. Certainly, our Medevolve.com is a great starting point because of all of our resources. We do a lot of thought leadership, a lot of content, a lot of great podcasts. So there's great places for our clients and prospects to start in terms of just learning more about industry trends and where we fit in. Info at Medevolve.com would get you into a discussion. Obviously, LinkedIn. Hit me up on LinkedIn. Like I said, I'm not against it. I love having conversations. If I could just spend my days ideating the next vision of the technology and having these types of conversations with people, which, by the way, gives me a lot of the ideas of where to take our right. business. It's exciting. Right. But it's not a complicated solution, right? I always joke when someone's like, "Oh, it costs money." It costs money. I said, "What? How much money are you willing to lose before you make investments in something that would have a really big impact on your P&L?" And remember, that's been a really challenge for healthcare software companies. I've been building software now since 2007, yep. And it's hard because the fires are so dramatic or perceived in these organizations that the thought of making changes is just not. You'll have an IT leader say, "No, we're not doing anything for 2 years," but then he's out of a job in 1 year. Right. Because we're really, really conscious of that. We're conscious of we don't want communities to get destroyed because they can't access healthcare services. And that's, we're talking about a rural health strategy right now. We're really targeting critical access in rural hospitals, communities, and provider groups because those are the ones that are going to suffer the most, right? If people don't have a place to go. And we also don't want, we want our clients to have the ability to treat patients, not try to say, I can only treat these types of patients because I get paid more. Right. What does that do for the rest, right? The rest, they end up in the emergency rooms of these local hospitals, which they can't pay that bill. So they're getting treated for, a cold. Next thing you know, doctor's like, well, and my twin, by the way, is an ER doctor. I have an identical twin in New Hampshire. And he's like, oh, I get all these level 1, level 2s. Parents are concerned about a chest cold. I hear chest pain. Next thing I know, I do a $5,000 workup. He's not going to get sued. He's like, oh, I'm going to do a CT. I'm going to do an MRI. I'm going to do all these lab tests. Who pays for it? Right. Who pays for it is the hospital writes it off as a bad debt case. Right. And that's going to keep crushing these revenue cycles. So a lot of opportunity out there. I think AI is good. I think that we're still too early to really prioritize where AI is going to help healthcare revenue cycle. There's just not enough data and information out there that it's effective. In fact, what we're seeing is a lot of these AI companies are causing more work and more wasted touches.
Yep. Absolutely. Yeah. This is fascinating, Matt. Thank you so much for joining. We should probably do a follow-up because there's just so much we could talk
about. Yeah, I know.
And
I love it.
Do another episode here in the coming months. But thank you so much. So yeah, if you find yourself in this in the loop of revenue cycle and feeling like you can't get out and you're trying to figure out where leakage is happening, where the wasted touches are happening, reach out to Medevolve. They can definitely help you. So thank you, Matt, for being on today.
Yeah, absolutely. Appreciate it.
Take care. Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.